I'm Rick Merle from Air Academy Associates, and I'd like to welcome you to today's tutorial as we discuss the contents we might expect to see in the fourth section of the A3 template. As you know, Vision 1 is using the improvement methodology DMAIC, so the fourth section is entitled Improve. In the DMAIC methodology, the purpose of the Improve phase is to improve the process by closing the gap between the voice of the customer, patient in this case, and the voice of the process. In the Improve phase, the primary measurement is driven to a level that shows the process is healthy and the goals of the process improvement effort are achieved. The tools of DMAIC were introduced in the Define tutorial. For this tutorial, we will first look at the list of many possible tools available for use, and then we will address some of the more common ones that you will see used in the Improve phase. For the Improve phase, we see tools such as mistake proofing, rapid process improvement workshops, standard work, 5S, brainstorming, and design of experiments, and more. As a general rule, the team should use the simplest tool that satisfy the requirements of the Improve phase. The Vision 1 recommended tools are a subset of the tool listing. Subsequent slides will address these tools in limited detail, as this should be a review of the tools you learned during the Green Belt or Black Belt course. Because the space available in Section 4 is limited, it is important that the team that is completing the A3 include the vital information that will fit in the area provided. All other information or additional tools that were used by the team should be included as supplemental documentation attached to the A3. We will now turn our attention to some of the tools that can assist us in the Improve phase. A very common but powerful tool that most people have seen or used is brainstorming. The good thing about brainstorming is it generates a lot of ideas. On the other hand, the bad thing about brainstorming is it generates a lot of ideas. There's a tendency with brainstorming to diverge from potential solutions because there are so many possibilities. It behooves the team to use the team tools such as multi-voting, nominal group technique, and pairwise comparison to prioritize and then evaluate a reasonable amount of potential solutions that were generated. Reasons why a team would consider using Brainstorm. They include it engages all members of the team if facilitated properly. It pools the knowledge of all team members, and it allows members to build off the ideas of others. Brainstorming also provides the team with some good documentation. Most, if not all of you, have seen and used a prioritization matrix. You have seen it in your belt training, and you can see it in the Vision 1 Performance Improvement System Guide. The prioritization matrix can be used to prioritize projects, potential solutions or ideas, as well as input factors from a fishbone. Using the Vision 1 format, across the horizontal are the criteria or requirements for not only selecting projects but prioritizing the solutions. The three main categories are alignment, achievable, and true north impact. The categories can be further subdivided by the team so that potential solutions can be differentiated. Examples would include, do they address the root cause? What's the time to implement? The cost to implement? Resources required? Is it sustainable? Does it add to patient experience? What are the training requirements? And others. The prioritization matrix documents the decision-making process the team has gone through to select the solution. Rapid process improvement workshops help to bring about quick process improvement. They are results-oriented and can range from daily continuous improvement and unit-based PDSAs to multi-month complex projects. They basically follow the DMAIC methodology with define and measure many times being done in the pre-work and control being accomplished in the post-work or follow-on actions. Leadership and management enhance the outcomes by making timely decisions and by making resource allocation a priority. Normally, the event is 3 to 5 days of engaged activity. You can see from the daily goals that this time frame is used by the team to analyze and improve the process. Rapid process improvement workshops analyze the current process looking for waste, variation, time sinks, status of standard work, and other things. Improvement tools like the ones we have already addressed are employed. Potential solutions are reviewed, prioritized, and selected. Improvements are implemented upon approval of management and leadership, and staff is trained. At the end, a follow-on action list is generated and approved. Typically, this list includes placing the process in control so the gains can be sustained. We want to validate and standardize our new process flow, develop a plan for sustainability, and create SOPs. We want to capture lessons learned. When the follow-on actions are not completed accurately and timely, the process improvements can suffer. In the healthcare world, mistake proofing is extremely important. According to researchers, one of the leading causes of death in the United States today is preventable medical errors, including safety issues, hospital-induced infections, laboratory mistakes, prescription drug mistakes, surgical errors, and others. Mistake proofing is a systematic approach to preventing and detecting errors at their source. Mistake proofing involves designing changes into the physical aspects of the design of processes. Design changes can prevent mistakes by simplifying or clarifying the work environment, making mistakes less likely. Mistakes can also be prevented by inspecting the source or cause of errors. Changing the design of healthcare processes and creating mistake-proofing devices is not a simple task. Careful deliberation and analysis will be required. Mistake-proofing devices are physical evidence that actions have been taken to ensure patient safety and reduce errors. It is important for the team to investigate what mistake-proofing can do to reduce errors, as well as what it cannot do. Lastly, mistake-proofing requires proper implementation, as well as accurate and complete documentation. Visual management is one of the simplest tools and is often overlooked. As the name implies, visual management is the ability to manage the work unit, department, support areas, and wards visually. The most effective visual management is when it helps the staff as close to real time as possible. When information is needed on current status, process performance, work priorities, or how to handle a situation or problem when it occurs, it's immediately visible, and we can immediately respond in some way. The closer performance measures are to real time, the better. Monthly performance measures that show averages across time make it hard to react hard to understand the causes of the problems, and hard to improve. Weekly, daily, or even hourly performance measures are more granular, still visible, and allow for better management. Examples of visual management include electronic medical records, huddle boards, facility status boards, weekly improvement boards, mission control room visuals, and others. Standard work, which documents the current best practice for performing a task or process and ensures that everyone is applying it, is a prerequisite for improvement. Standard work promotes efficiency while reducing variation. It's hard to improve a process that is not well understood or consistently applied. Once standard work is in place, opportunities for improvement become apparent. When people perform their jobs according to the standard work, it is easy to shift the blame for breakdowns and errors from the person to the process. Because the team members who will perform the processes are involved in the creation of standard work, they become invested in making sure that it truly reflects the best approach. Having standard work in place means that we are trying to address the causes of process problems by creating a documented baseline, and that we train to the baseline standard. Then we audit the standard to confirm it is being followed and is the current best practice. 5S is a systematic form of visual management. However, it is not just about cleanliness or organization. It is also about maximizing efficiency and saving money. 5S is a framework that emphasizes the use of a specific mindset and tools to create efficiency and value. It involves observing, analyzing, collaborating, and searching for waste, and then removing that waste. You are probably familiar with 5S, so I will avoid detail here. Sort, set in order, and shine showcase where the methodology became synonymous with cleanliness and order. I want to highlight the last two S's, standardize and sustain. By standardizing work procedures, systems, and policies, we are able to reduce variation. By regular review of SOPs, processes, and regulations, we ensure that the work unit is using the most current and most efficient way of performing the process. We prevent outdated information from adversely affecting performance and creating defects. 5S provides documentation so that the work environment is clearly defined, self-regulating, and self-improving. An audit system should be put in place to ensure currency and compliance. This slide is a reminder that once the project improvement option has been selected and implemented, it is now time to complete a new process flow, a new IPO, and new standard work. Those three tools will become an important part of sustaining the gain made in the process improvement effort. Now let's look at the improvement phase of project ID number 161 to see the content that was selected by the team to put on the A3. Once again, the team can only highlight so much in the space allowed in the A3 template. Supporting documentation would accompany the A3. This A3 report includes the main accomplishments of the improvement phase. It highlights the new process. The completion checklist contains the questions that the process owner or manager, as well as the team leader and team members, can ask to tollgate the improvement effort to ensure that the improve phase is properly completed. By following this checklist approach, by the time all the questions have been answered in the affirmative, the team can be confident that it is time to move to the next phase in the improvement methodology, which is the control phase. Thank you for attending our tutorial today. I look forward to having you back again for the next A3 tutorial, which addresses the A3 report and the control phase. Good day.